layman term, or layman, maybe it's not a general public layman, but the lay healthcare worker, I will often refer to them as mets, the metastases. We're so lazy. We want to work smarter. I want to shorten everything. The mets, if you hear me or another healthcare worker say they've got mets, if you just hear someone say they've got mets in their liver, you know, okay, there's metastases of whatever's going on. To know them a little bit, that kind of stuff. Okay, cancer can occur almost anywhere in the body, right? Anywhere, skin, eyeballs, brain. This is cell replication, right? That light switch goes on. Something's weird. We don't know the exact cause of cancer, or the cancers. We know that there are big time risk factors, right? Like history, a family history of cancer. If every single person, every generation, right, had that cancer, right, we're thinking there might be a genetic component to it, but we don't have that real, this causes it. And then why do we have people who have no history then can develop it, right? So that shows us that we don't really have a good understanding about what causes cancer. But we have a list magnitude of things that are risk factors. And what do we know about healthcare? And what do we know about being healthy? We want to try to just reduce whatever risk factors we can, right? Small steps, a little bit helps. So smoking, alcohol and drug abuse, right? A poor nutritional diet can be a risk factor. Exactly, Brenda. So many things, right? A little bit of genetic predisposition, maybe plus external risk factors, right? Circumstance. How did the wheel of fortune land for me, right? Lots of different things. So that's why we say we don't really know the cause, right? Poor nutrition, radiation, right? So if we think about like movie level, lots of radiation, melting, and then I become a zombie, right? That radiation has an effect. But on us, we're getting radiation from the sun at low doses, right? All of that kind of stuff. Yeah, excess sun exposure is a risk for melanoma. Exactly. So we're getting that radiation from the sun. So it's not a radioactive bomb is getting dropped on Canada. We get exposed to radiation. We get exposed to it. Okay. Certain chemicals, glyphosate, for example, is a big one in the media. We know that it actually can cause genetic changes to cells. So you have to use farmers that use glyphosate, that use extreme PPE, right, to reduce the risk of exposure. Why do we wear PPE into our clients' rooms? Oh, if you don't know what it is, not a big deal. And the whole point of it is not to have a conversation on glyphosate. It's just a type of chemical that is put on crops. There's lots of people at very extreme ends of the glyphosate conversation. Monsanto, Bayer owns Monsanto and all that kind of stuff and whatever. That's not the point. We know that the chemical actually is harmful. So if you're using it, you need to use a lot of PPE. Problems. Regular people want to use it in their backyards instead of like in major farmers' fields. It's actually illegal to like have in Canada. You can't order it. You can't get it at Home Depot. You can't do that. Reduce risk. But you need extreme PPE. That's all I'm going for. So chemicals that we work with can be those exposures that can cause these abnormal changes or something like that, okay? Hormones, okay, we think is a risk factor. There's changing hormones perhaps, or abnormal levels of hormones, right? We don't really have that real answer. Viruses, some viruses might be doing something, and then we end up having this metastatic growth happening, I don't know, of that tumor, right? Some malignant cell growth here or there, and then some metastases. Canadian Cancer Society is your resource. for cancer here. It's great. I actually did a placement, a nursing placement with the Canadian Cancer Society, doing information over the phone to people. Yeah, Charmaine?
I know somebody was in an accident, a motor vehicle accident, and she developed cancer afterwards and died. What could have caused that? What in all of these factors?
No, can't. That's a loaded question. That's a correlation, not causation. Car accident equals cancer growth. Not enough information for this kind of conversation. Yeah. The fact that she had a cancer diagnosis after a car accident doesn't mean that the car accident caused cancer to grow. There could have been cancer in her body from 10 years. They only found it after the car accident.
Okay.
So it's a real loaded question. That one's too hard. Yeah, not enough information. Okay. If our best option, we want to identify it early so that we can get treatment early. That's what we want. So noting changes in our our habits is really important to notice that, because some things we don't notice, right? Our body is really good at. It wants to have this homeostasis, right? We've talked about that before. It wants to keep you in your best way. So if something's going icky, your body's actually going to try to compensate for that. So some things we might not notice right away. And they're going to get on and move a little forward, and then we see them only when some worse symptoms show up. You think, oh my goodness, didn't find it before. That's why we actually encourage people to go for regular screening. Why are you going for your fecal occult blood test? Why do they send you that thing in the mail? Why do you take a poop sample for your doctor after age 50? 45? I don't know when they start. 42? When they start sending you the information? Whatever. Doesn't matter. I don't know what age. But why are we doing a poop sample? You know what they're looking for? Colon cancer. Signs of colon cancer. Signs of stuff, because we're not going to notice it. We're going to notice it very late. So if we test for it, we kind of catch it early. Why do we send women for pap tests? To catch cervical and endometrial cancers, abnormalities early. Because who's looking at the cervix to know that there's cancer cells brewing in the cervix, right? Now it makes sense why I have to, right? Oh, that reminds me, I haven't been to the doctor in 3 years, right? Everybody's going, shoot, I need a real doctor's appointment, not just an immunization appointment, right? Yeah, Linda?
Speaking of the pap test, because of COVID, no one is actually seeing you in the office. I haven't had that in over 2 years.
Okay.
Like one done. I just think it should be like
Well,
women are.
The doctor and say I want a pap test. That's all you need.
They were usually mandatory every year, but now it's over 2 years. I'm just kind of curious why.
Because of money and time. People don't have time to see you every year, and it costs money to run this.
Sure.
And then they do research to show that, every other year is enough to catch it in time, so then we can spend less money on the testing part. So they're going to reduce as we get more evidence. Then they can change the times. In that sense,
I just noticed it's been over 2 years. Could be almost 3 years now. So
yeah,
hopefully I'm fine.
Some people have been 20 years without a pap. Going to pap, but yeah.
Okay.
You make a pap test for yourself if you want one. Colonoscopy, are you talking about the FOBT that I was talking about? The fecal occult blood test? You take a sample of the poo and it goes to the lab.
I'm talking about the ones that they
camera up your butt.
that one.
That's not a test of your feces.
Okay.
Occult blood test, we're testing your feces, like a urinalysis. You piss in a cup, we send it to the lab. You poo, we send your poo to the lab. Colonoscopy, we're looking up your butt live on camera.
That's different.
Yeah, they're two totally different. They're not even near the same. Yeah. One's yeah. Linda, yeah, again, or just a hand up. Okay. Okay. Usually, depending. There you go. Nasser didn't even realize. She's getting all her tests done. So usually, if possible, we're going to remove any cancer, right? Any malignant tumor. by surgical means if we can. Sometimes we can't remove all of the tumor. My brother's brain tumor was in his cerebellum on the top of his brainstem. So they remove most of the tumor, but they cannot scrape the brainstem clean. So they have to leave some tumor, and then they gave tons of radiation and tons of chemotherapy to kill the rest of those cells. Kind of makes sense? So they took as much tumor as was safe, and then they had to leave a little bit there, and then they gave them tons of treatment. See, so you follow, so everyone's situation is unique, and their disease process is unique, and the location and what they can do, okay? The radiation is targeted radiation where you go and you get a laser shot in to kill those cells, kill, okay? The chemotherapy is drugs, okay? We can take them orally, some are pills, some are by IV. There's lots of different kinds of chemotherapies that people might be prescribed, but that is typically systemic. So the radiation is usually very targeted. We're shooting laser beams at the bad cells for the visual. Shoot those laser beams, but the chemotherapy is largely systemic. So if I know that cells are going on picnics around my body through my bloodstream, right, that chemotherapy is killing everything. So why do we know that people who are getting chemotherapy have no immune system? Because the drugs that we give them are killing everything. Because we want all of the bad stuff not to regrow, and all the good stuff will start back up again. Okay? So there's your big umbrella, your big crayon level explanation. Crayon report. Okay. Sometimes we might have stem cell transplants, so certain kinds of thinking cells. We might try to transplant some cells. There might be bone marrow transplants, so we might take some bone marrow from someone and give it to somebody else. Okay. There might be umbilical cord blood stuff now, but that's newer because people nowadays, some people are trying to save their umbilical cords from their children, and they pay to have them frozen. Yeah, and then if they have a cancer later on, then they're hoping that we might have the science to do targeted stem cell therapies and things like that. So people are actually starting to save their cords. Yeah, Myrna nailed it exactly. That's why we, yeah, she's exactly, one cancer cell left will again multiply. So that's why we put you through 12 months of chemotherapy, right? We keep doing, because we're going to kill until it cannot come back anymore, hopefully. Or we might see it regrow but regrow slower, regrow less, right? And we add that targeted radiation. We're hoping to reduce its risk of metastasizing and doing more damage, right? So last couple of notes before we go to break. Clients with cancer have tons of different needs, from infection control to pain management to mobility, mental health, nutrition, fluids, skin breakdown, bowel and urinary system issues, treatment side effects, right? Our clients who are facing cancer have a lot of needs from us. We're helping to support them in a lot of ways. Okay? So we need to be not only thinking of the care plan, but also thinking about this person in front of us. Like, how does this diagnosis relate to, and how does my knowledge relate to the care I'm about to give? You know what I mean? So if I know my client just had chemotherapy a few days ago, I know their immune system is really dying right now because we just gave them all those drugs, right? So they're getting weak, and they're lethargic. I don't want to eat, I'm nauseous, and just get my chemotherapy, right? So that care that we're doing, the healthcare team, the nursing, and the PSW staff attending these clients, it's very important that we're thinking about them holistically, right? The psychosocial stuff, the pain management for sure, that nutritional status, right? Is a boost a good option here? Ensure a good option here? If I'm so nauseous that I can't keep the food in my stomach, and I take a sip of something with extra nutrients, right? So just to have that in our mind's eye when we're dealing with our clients like this with cancers, okay, or with metastasized tumors. Just have that in mind, okay? Let's stop now. We'll go to our 15-minute break. Let's reconvene at 10:40, 10:50. 10:50, please. Oh,
Now it's 10:34.
yeah, so it's 15-minute break, right? Wait, no, am I wrong? 34, 44.
I hear 15, sorry.
550, not 10-0, 50, 50. I can do it. I go have a break, go have a toilet. All good. I figured out why I was confused when I had respiratory on my list for today, and then it was like influenza, tuberculosis, it's respiratory. And then I just read my notes properly. Those ones are under the communicable diseases section. That's why I had respiratory today. So I'm gonna stick with my plan as I had it written, in a good shape. Okay. I just shared this little note here so that you can see that where your presentation will fit under which category against the syllabus. However, as I mentioned, this is what I'm asking you to do in the group time that will be given to you today. Should not take longer than 1 hour. So what day, like that, it's not homework at nighttime. It's already going to be done. And then when I'm like, okay, let's talk about the cardiovascular system, when I get to coronary artery disease, someone will be like,
Good morning,
We're
Wilson, Bear
presenting.
PH.
you can just say the 5-minute spiel.
Breakfast
If I have
time.
anything to add, I'll add it, and we're going to move on. Just move a little on. So you will be able to finish it today, and it won't be a stressor. You'll just be sitting there waiting until we get to it on lecture day, okay? Alrighty? Okay, very good. So, welcome back. I'm going to try to get through my musculoskeletal section prior to lunch, so that we come back from lunch, I can do respiratory real quick. Then y'all can leave and go into your small group to either work together and answer 4 questions, or split the 4 questions up into 2 people. And then finish. And I approximately day 3. I gotta schmooze the topic sometimes. We don't have enough time, or and it goes on the next day or whatever, but it'll at least give you an idea when we're about to go. Okay? So, when I talk a little bit about MSK, musculoskeletal, we covered some of this, I think, with safety mobility, right? Some of this content, some of the stuff was with PSW foundations, because we were learning about turning and positioning. We did some range of motions. We started to learn about the musculoskeletal system already. So you already have some knowledge here. You totally already have some built knowledge, which is great. Okay. Oh, I just realized it. Okay, that this thing that's appearing is my knee. I am sitting. All my legs are on my chair. I just realized how weird it looks. There's like a body part appearing sometimes in the green screen. It's my leg. Just so you know. So nobody in class with us. That is my. I need a ergonomic desk and chair to sit at. So I am putting myself into poor body postures in an effort, right, to change my position, thinking about my client, right, in their wheelchair, in their bed. Adriana too, right? I'm saving my money for one of those desks that can rise up, so I can actually stand and then talk to you standing, and then I can sit down, but they're a little pricey. So eventually I'm gonna get one. Yeah, let her get you a good chair, Nestor. Just like my spiel about the good shoes, I don't care what you think, I don't care what anybody tells you, I'm telling you, you need good shoes to be a PSW, not just good shoes, you need excellent shoes to be a PSW. You're going to walk a marathon a week. Why do marathon runners get good shoes and PSWs don't? Distance, man, the distance is the same. I don't care that you're not a marathon runner, you're doing this distance, you need good shoes. We learned alignment, ergonomics. You're going to be pushing, pulling, lifting, bending, moving, reaching every day, all day. Your job is going to be like this, walking, and not walking like I'm out for a little stroll. You're going to be walking. I have been sweating on my shifts before because I'm working hard, right? I need a non-skid table. Yeah, right. How about let's just do table organization? That's the better starting place. If I didn't have so much garbage on my table, I wouldn't have so many spills and things on it. But yeah, that's a organization problem. But yeah, let your daughter get a good chair for you. Say absolutely. When people want to get me a good present, don't waste money. Even if it's something expensive, get me a gift card. So because I want a $500 chair, or I want that table thing for me. So you know what? I'll tell my family members and friends, I'm like, I'm actually saving for a $500 office chair. I would really appreciate a gift card to Staples for Christmas this year. And then maybe I can take it. It's only a $350 chair now because some people gave me gift cards. But I'll tell them, don't get me LCBO, get me Staples because I actually really want something this year from Staples. I'm saving money for it. Right? Easy peasy. Work smart. Ooh, a gamer's chair. Yeah. Because they're sitting in it, supporting them, right? Hey, Master, I'm just imagining her now with this chair, like with LED lights, and it's like flashing. She's sitting sewing, and the chair's got speakers in it. And she's sewing and listening. I can only imagine. All right. So, musculoskeletal disorders. Can I do it in an hour? Maybe even less. Work central and ergonomic chair. Oh, that's so nice that you got one. So nice. Love it. That stuff is so expensive, man. But yeah, great help for our body alignment. Okay. So musculoskeletal disorders affect our ability to move, affect the musculoskeletal system, which we need for standing, for walking, right?
Joy,
for eating.
thank you for
We need our
coming.
body to move. Okay. It can affect bones, the joints, the muscles. So that whole
Closing
muscle,
PH, thank you.
skeletal, muscles and skeletons. Muscle skeleton disorders, okay, musculoskeletal. So bones, joints, muscles, okay, could be because of aging, could be because of injury, right? We have some natural things going on with our body as we age. We know that now, right? Normal aging process. But then there's abnormal stuff as well. So it could be injury, could be aging, few things, okay? But also,
Di kan ako nagmata. Wala pa ilis, di siya natulog.
you can have a musculoskeletal issue young or in your later years, right? We even learn about some, we've talked about things already, like, I don't know, did we talk about osteoporosis? We'll be older.
Salamat, Joy.
Older age and younger age. Where's my piece here? Might be
Wow,
broken bone.
congratulations,
I
anak.
break my bone.
That's good.
I
Ako layo
can't
pa
use it
kaayo
until
as
it's healed.
in.
Right, I need
Ako
to take precautions with
Ako ang
it.
subscribers
It might
ko
need to be
layo pa
reset.
kaayo, pati
And then it's
ako
going
ang
to heal, and then I
WH.
can have my mobility back, hopefully, and all that kind of stuff. So it might be more temporary, or it might be long term. It might be progressive worsening.
Unta
Some might be
ma-approve ka
getting
na
worse.
dayon.
Okay. If I look at broken bones in particular, the bone is injured, right? But the tissue around that fracture, right? So it's fracture, broken area. Not only is the bone broken, right, but the tissue around the bones, right, the muscle around the bones, there's some trauma everywhere, right? That whole area is going to experience that traumatic event, right? So you might have injury in the muscle around it. You might have the blood vessels around it might have some injury, bruising, things like that. The nerves might be affected. Fair, like there's stuff that is in there. Tendons might be affected. Sure.
Congrats
So
in
there's
advance
two
now.
types. They're going to type us with two, the PSW perspective. No going to the orthopedic surgery website and then coming back. Hey, there's
Tangan na
more
to na
stuff,
imo
Ali.
premier pag monetize na.
Right? But we're going to talk about closed or open. We've talked about it a little bit before. Okay? Your closed is also known as simple, according to Mosby. Closed is simple, and open, they're classifying it along with compounds. Okay? Compound fractures are open. If a bone is sticking out of someone's body, I've seen it happen numerous times, that is open. It is open. Okay? I have witnessed it happen 2 times. Witnessed it with my eyes, both in sports games. One was in, it doesn't matter what my role was in these games. However, One of them, of course you can't see, but her tibia, this bone, the shin bone, it exited, it broke under her
Ang
knee up
lesson
here,
namin ngayon,
and
ano,
the bone was
cancer,
like this,
musculoskeletal, o ano,
sticking
respiratory
out.
health disorder.
Instead of connecting to her knee, the bone come out like this.
Very heavy ang among week,
Ooh.
pati next week.
I watched it happen. She went to the hospital to have orthopedic surgery immediately.
Cancer,
The other one that I
musculoskeletal,
happened
and
was also in a
respiratory
sports game. My friend
disorders.
was playing rugby and he broke his arm, and the bone was sticking straight out of his arm. It's real open, right? Shocking, yeah, right? Shocking. Oh, Tracy, my half brother broke his hip at age 5. Was hit by a car. 3 hip replacements since.
Ano sa po na mga maestro, ay masay mag-in-English.
There's a young musculoskeletal injury that's affecting this person for years. Right? He's having chronic stuff related to that acute injury. But yeah, the 2 open fractures that I witnessed were both under the age of 17. Kids are seeing that because we're the ones that were on the field, and it happened to our colleague. We got 2 teams and everybody on the sideline. You don't even think, right? We don't even realize. It's like, oh wow, here we're so privileged, we're so sheltered from everything bad that happens. It is mega shocking. In other places, it might not be as shocking, where you might have actually seen violence more.
Ako po,
than here.
mora po na ang
But for some
naintindihan
people
ko,
here,
may
it is
fracture.
very shocking to see something like that. This does not
Pati ang
exist.
shocking daw.
People don't get injured like this in real life. It only happens in movies. So there's a psychosocial piece to go along with that. A little side for my kids that are experiencing these big fractures or big injuries. Like that's tough. So fractures, these breaks, right? Fractures,
Huh?
causes,
Bakit
mega cause, falls. Who's falling?
Bakit
My
may time out?
98-year-old client out of their bed because I left their bed at the highest height. Oopsie.
Sige.
My client who I'm transferring, who I didn't wait for the orthostatic hypotension. Are you
Bakit
busy?
na time out?
Remember? Sitting or lying to sitting, we check on that dizzy factor. Sitting to standing, we check that dizzy factor. Did my client fall because I
Thong
didn't
ba
wait?
gusto ni baby ko?
Fractures.
Joy, gusto mo ng thong?
If I just want to put it together, right? We know that if we don't keep walking, if we don't keep mobility up, we're losing. So what happens when I send that client from the long-term care home where you're walking them, where they're getting exercise every day, and they go to the hospital with a broken hip? What do you think is going to happen to their ability to walk? They're going to lose a lot of strength during that hip recovery, aren't they? What do I know about their nutrition? What do I know about their ability to heal at that age? What do I know about the acute system and the ability to do those walks, to do the mobility? They don't have that staffing there to do the long-term care stuff that we need to keep people healthy. I'm not saying that's right.
Thank you,
or
Joy.
ethical, but right, if I'm looking at the circumstances, I can see that the decline.
nga, daming
So
account ni Joy.
I want to stop that from happening. I gotta avoid the fall that breaks the hip. Don't let them fall, then they won't go to the hospital for hip replacement surgery. You know what I mean? So if I work safely, if I employ my students, I cannot have them fall and break their hip. And they're going to stay walking around, and I don't need a lift times 2. They're not going to be wheelchair bound forever.
Bakit kaya na
They're
time
going to still
out?
walk. And so there's our little kind of full circle piece here, right? I know it's a little off, but okay. Accidents.
Baka may na
Some
ako.
people
Baka may na-press
might
ako.
be
Ano kaya?
related to
Wala naman.
osteoporosis. Okay, so variety of reasons though, that we're going to have see fractures. Signs and symptoms. Limb
Salamat, Joy.
looks bent or out of position. Yeah, if it looks broken, there's a high chance that it is. See somebody come and they just caught the football and their one finger is completely sideways this way. One finger is this way, but they're holding your hand up. That finger's broken. It's broken. Go get it reset, right? I've never broken a bone or sprained anything. Can't imagine the pain. Knock on bloody wood. You knock on everything. But okay, just there's lots of different things that could be going on. If it looks broken or it's out of position, it probably is. Just a quick reminder, as PSWs and as nurses, We cannot diagnose anything. It is against our scope. So it doesn't even matter if your hand is sideways. I cannot diagnose you with a broken wrist. You got to take an x-ray and the doctor has to tell you that it's broken. I can't do it.
Sorry.
So don't walk around being like, ooh, that's definitely broken. You don't know that. Only the doctor knows that. Even if it's obvious to you,
family
it's not in our scope to say those things. So it looks really good. You can agree and empathize and do whatever you need, but you are not going to diagnose broken bones. That's it. This is a funny one. Okay. But yeah, if it looks bent or out of the position, it's probably freaking broken. Tell them to go to the hospital. Tell them to go to the doctor. Get it checked out.
Okay.
It doesn't look so good. It must hurt. You should go see the doctor. Don't tell people you know it's
Meron na
broken.
nilagyan ko na. Sorry ha.
Okay. Pain and swelling. Right? Pain and swelling makes sense, right? If something's going on and it's sideways, something's probably going on in there, right? Something's not right. Spidey sense is going off. Bruising turns purple. Well, it looks when you hurt your joint, and then all of a sudden your joint looks like my background. The skin looks like my background. That's your body telling you there's a problem, right? I don't want my skin turning because there's usually more green in there, but yeah, you get the point there, right? Ooh, yeah, right. Long. Why? Because you probably kept walking on it, right? You didn't allow that time to heal. Broken femoral strain. I'm not going to make a formal comment, but yeah, you get healing with the broken bone. Healing. Sprains are very difficult to fix those muscles back up the way that they want it to be, right? Anyways, there could be bleeding internal, could be bleeding externally. That bone left the body. Anyways, what they're gonna do, you're gonna go to the hospital. They're gonna put it back together. How they're supposed to fit. They're gonna put the puzzle back together. Okay. And then they're gonna put a cast on it, or they're gonna brace it somehow so that you don't use it, so it can heal. Okay. So you might be helping with cast care. You might be doing care plan stuff with mobility. Maybe they can't feed themselves anymore because they broke both arms. And now they can't eat, so you have to go and feed. So I don't know. Temporary loss of independence there for feeding. But on page 852, you're going to have that box of guidelines for cast care. So as you go through, you'll see help for taking care of casts for PSWs, you know, those little boxes that come. So cast care is in there so you can review. Okay. Might be fiberglass, might be plaster, different types of casts these days. Now this one is not out of Mosby's, this is out of my own knowledge. We're even doing 3D printed plastic types, depends on the injury. So right equipment for the right purpose, but Mosby's mentions plaster, fiberglass, and plastic. But that plastic, what I'm seeing now, is 3D printed, which is really cool. But that's new technology piece that's happening, right? For hips, we see this really common in our older adults, right? Signs of a fractured hip is a short leg. That leg is all of a sudden real short, or the leg is turned a weird way. The whole leg, right? Because the hip is out. The hip is busted. So the whole leg is weird. The whole leg is not normal. It's not just a toe. It's not just an ankle. That whole leg is not in the right. That doesn't seem right. Oh, and now it's significantly shorter than the other leg. I never noticed that before. Oh, and she had a fall last night. And it looks like my background. Spidey sense, right? I've compiled a bit of documentation here, right? A little bit to report. Post-op problems. Yeah. So like that person that we send, things that you could end up with might be like a pneumonia. You might end up with urinary tract infections because you're hospitalized, you can't move, you can't walk to the toilet, catheters, high risk, UTI. See how there's a whole plethora. There's a multitude of issues that go along with all these health conditions, right? If you get that hip fracture, now we're worried about a whole bunch of other stuff. Ooh, there's a really good reminder. And I ask you, like, what kinds of things are you thinking about as the PSW when you're caring for someone with a hip fracture? Skin breakdown, urinary system issues, right? Because they're probably, if they can't walk and they're confined to a bed because of a fracture, they can't toilet themselves, they can't bathe themselves, they can't. So what do I know about my role as the PSW? I might be helping to bathe that client. I might be thinking about a catheter with that client. Maybe they have a brief if they can't walk to the toilet and back. Do you think I might need to do range of motion exercises with all those good limbs to keep them mobile? What are you thinking about as a PSW when I hear my client has this condition? Yes, your care plan is going to tell you what things to do, but you have knowledge now. These might be issues I'm dealing with. I should be cognizant of them. You're thinking about them when you're looking at the care plan. Does the lady have a catheter? Check my care plan. Okay, she doesn't. But I thought about it because I knew she's in the hospital for hip surgery, and I know,
Salamat.
right? You see how you know
Salamat,
things now?
bossing.
You're starting to rely. You can start to pull them out of that file cabinet back there. That unconscious file cabinet. Bring it out to the front. Okay? So there are some risks. Same type of thing. We're gonna fix the brake somehow. The orthopedic surgeon, the team is gonna fix that brake somehow. They might replace the entire ball part of the long bone.
Jay,
They
Just
might
study
have a plate,
Cancer.
screw, just a screw. You know, because I don't know what the
Musculoskeletal
nature is.
and
There's different
respiratory.
things, right? There are different surgical
Cancer
interventions.
ba?
Right. So there's stuff that they can do depending on the actual hip
Init lagi
fracture.
kaayo, Jay. Ay.
And most of
Init
these
kaayo,
things
no?
you
Dili
will
ka pa
find
na itong aircon.
caring for the client with a hip fracture.
Init kaayo.
So you can review that box as well when you get through that hip fracture section. Those of you who pre-did readings, that you might have already read it or you kind of saw it already, you know, go back and check it. Osteomyelitis is inflammation or infection
No,
of
close
bone marrow.
naman.
Okay. Often caused by bacteria, but it's not a permanent marker. Okay. It can be a complication of a fracture or a bone surgery. Right? Makes sense? Something happens to the bone, bad bugs get in.
ABC, all of the
Infection.
above.
Now I have infection bone, right? I can follow. Hopefully, we can like start to see those steps.
Ala, may ihim-ihim na
We're
pala si
walking on
Joy.
those steps. Okay, see how she got to that from
Talaga
a
si
bone.
Joy.
We opened that bone, infection, didn't we? Open. It's an opportunity for something that's not
Wala na
supposed to be there to
magipanitan
get in.
man good.
So that's it.
Reklamo imong mother
If
dear.
it's bacterial,
Dili,
then
ana siya nga.
it
Ako,
might
anak,
have been
kasabot niyo panitan. Di ay ang... Opo, ana siya. Iguwa.
It can be really, really painful. Stuff with
Ikaw
bones.
kabalo magud ka.
Stuff with
Imong anak,
bones.
chef magud na diri sa Canada. Dili na chef sa Pilipinas. Manawa siya
Stuff
kabalo
with
mag
bones.
ko panitan diri
I
siya.
don't care. I don't need emojis. I don't
Wala
need
naman
all
yan.
the literature. Stuff with bones hurts people. They are in pain when they got bone stuff going on. Whether it's a hip fracture, whether it's bone cancer,
Panitan
if it's
siya.
bones.
Green man gud dili man yung panit. Green ra
Just,
gyapon siya.
okay,
So it
just
seems
keep that
like
in
wala
mind.
naman siya
Dealing with people
panitan.
with bone problems or bone issues or something going on, they probably have pain. Ask them about
Hindi
their
niya ako
Okay.
pinapabayaan
Report.
sa LS ko kagabi. Oo nga.
report and record, especially changes.
Oo, ang ano mo is nakatambay lang naman
Some
itong ano ko
people live in
kagabi sa
pain
ano.
daily.
Ay!
And they have an acceptable level of pain. That's
Kayo na ba,
okay.
Joy?
When that person tells you it's worse today, right? It's worse. It's something's not right. They're still telling you
Nandoon siya
that's
kagabi,
abnormal,
nandoon
even
yung
though they
isa
normally have
kagabing
pain. It's
ano
not
eh.
their normal pain. See how there's still that change?
That's
You're
so
still gonna report.
nice.
Okay. Amputation is the loss of a limb. We take it off. Okay, we remove it, a piece of it.
Sagutin mo na kasi,
all of
bakit
it.
meron pa isang asungot doon sa
Many of
picture
you
mo?
will relate amputation to poorly controlled diabetic clients who might have had a toe amputated or all of their toes amputated or part of their foot amputated or the whole foot or then up to the knee. See how we start as distal as possible and then especially distal.
Doon mo nga,
We won't
sagutin
take
sa
the whole
LS
leg
mo.
for a toe. We'll start by taking the toe. Okay.
Ano yan, masaya yan.
Tracy, sorry, was that about bones or about diabetic amputation?
Oo nga, may
I
asong
don't know if
doon
that
sa
was close.
picture mo.
Both. Oh, sorry. Yeah. But yeah, so she's just clarifying, right? It's painful. He was in a lot of pain. And what do we know? Pain plus mental health, right? The psychosocial effects, the independence, the aging, the pain, the diseases. It's tough, man. It's tough. Okay. What you're gonna be most commonly seeing, or what you're probably most commonly aware of, is the diabetic amputations. Okay. So, I'm not gonna, because we got a group that's gonna do diabetes. So perfect. Shut up, Allison.
Allison, that's my report.
What's gangrene? Gangrene. It's
Oo, nagstay siya kagabi sa
really, really bad.
Unless,
infection.
Sir Mark
Really,
Sinezan,
really
salamat. Ano na mga
It
topic
will
namin ngayon?
spread
Cancer?
systemically if it's untreated.
Nakikinig ako habang
We're gonna surgically remove that
nagbabasa.
tissue that is infected. Could happen because of infection. It could happen because of really bad frostbite, burns, circulation issues. There's a variety of reasons people could get gangrene. Okay. Painful, contagious, moves quick. We have to get on it quick. But because it advances quickly, the damage progresses very quickly. So we actually need to document it.